Can Lyme disease cause joint pain? Lyme arthritis explained. Joint pain that comes out of nowhere, moves from joint to joint, or settles into one badly swollen knee is one of the most recognizable faces of Lyme disease. In fact, arthritis is often the symptom that finally gets untreated Lyme diagnosed, sometimes months after the tick bite that started it all. Here is how Lyme arthritis behaves, how it differs from everyday aches, and why it is so treatable when it is identified correctly. How Lyme disease reaches the joints. In the weeks after an infected tick bite, the Lyme bacteria can spread from the skin through the bloodstream to other tissues, and joints are a favorite destination. Early on, this can feel like migrating aches, pain that visits the shoulder one week and the hip the next. True Lyme arthritis, with visible swelling, is typically a later stage sign, appearing months after the initial infection. According to the CDC, roughly 60% of people with untreated Lyme disease go on to develop intermittent bouts of arthritis. What Lyme arthritis looks like. Large joints, especially the knee. One or a few joints are involved, not the symmetric small joint pattern of rheumatoid arthritis. Impressive swelling, milder pain. The joint is often visibly swollen and warm, yet less painful than the swelling would suggest. Episodes that come and go. Swelling can flare for days to weeks, settle down, and return. Little morning stiffness compared with autoimmune arthritis. Because many people never noticed a tick bite or rash, Lyme arthritis is regularly mistaken for an athletic injury, gout, or early rheumatoid arthritis. How it is diagnosed. By the time arthritis appears, antibody testing is usually strongly positive, which makes this stage easier to confirm than early Lyme. Early infection is a different story, as we cover, and why Lyme tests come back negative. Your physician may also test fluid drawn from the swollen joint and will rule out look-alike conditions. Can it be treated? Yes, and usually very well. Lyme arthritis generally responds to a course of antibiotics, though large joints can take time to quiet down completely. A small subset of patients have inflammation that persists after the infection is cleared and benefit from additional anti-inflammatory treatment. Joint symptoms can also overlap with the fatigue and brain fog of later-stage Lyme, which we cover in how Lyme affects the brain and nerves. Visit the link in the description below for more information.